Continuing now with one of our top health stories tonight, Chicago health officials have found 203 cases of COVID-19 connected to this event right there, Lollapalooza. However, they are not calling this a super spreader event.
And joining us now to talk more about this is Dr. Vishnu Chundi right now. Thank you so much for being with us today.
Thank you for having me.
Let's get into this. Do you believe the precautions and the regulations that were put in place for Lollapalooza helped to slow down COVID spread at Grant Park?
Absolutely. If you look at what happened in Milwaukee after the Bucks victory, they had a spreader event there with the increase in rates. Here we see no increase in rates after almost 400,000 people were there. So Chicago is a city that works for outdoor events. It showed, I think, the nation, and they should take credit for it, Mayor Lightfoot, as well as Commissioner Arwady, as well as the folks who run Lollapalooza, should take credit for this. And in full disclosure, the Medical Society has been working with them and since February to do this correctly. So testing and getting people vaccinated in outdoor events, you can do this, pull it off safely.
Okay, so with that in mind, if it's possible to pull these things off safely with the spread of the Delta variant, do you think that large-scale events like Lolla should continue to be on the schedule?
Well, people want to, this is not a virus that's going to go away magically after a 3-month period. This is something we're going to live with for a prolonged period of time, years, okay, as these waves of different variants come through until the whole world is vaccinated. So people are not going to sit at home and not do anything. What you don't want to have is what's happening in Florida, Texas, and some of the other states with high mortality rates. What you want to have is a controlled event where people are vaccinated, they take the precautions, and understand that there's risk. It's much like wearing a seatbelt in a car with airbags. Yes, there are accidents, but it's as safe as you're going to get when you want to continue on in life.
Dr. Chundi, let's talk about this mask, because that is a big issue right now for a lot of people. They are once again being required in many indoor settings, regardless of vaccination status. Do you think that will actually push the unvaccinated to go and get the shots?
I don't think that's going to push the unvaccinated to go in to get into shots. If you look at what the European Union has done, they've made it so people have to get tested all the time if they're not vaccinated. The other things is what the United Airlines, which should be commended, and the hospitals are doing. Our own group, Metro Infectious Diseases, has had a policy where we will not have anybody who's not vaccinated be working with us anymore because it's simply not safe. So you're going to need the private people out there to go out and do this. Masking itself is as safe as vaccination indoors. You cannot walk into an area without a mask indoors with the Delta variant. You are going to get yourself infected if you're unvaccinated.
Do you have any information for our viewers this afternoon with regard to mask effectiveness? I've seen certain health people in the health community saying if it's not an N95 mask, it's largely for show. How would you respond to that, Dr. Vishnu?
Well, that's not correct, because any mask is better than no mask. Okay, and so your surgical mask that you wear is fairly effective if both people are wearing it. And N95 is really meant for healthcare situations. You can't have the whole public wearing N95 masks. So the compromise is to wear a surgical mask. If both people are wearing surgical masks, it's as effective as a vaccine in preventing spread of the virus. And it's not this stuff where people are wearing the masks around their chin. You watch the NFL football games, half the people are wearing the mask under the chin. That's not the way to wear it. You got to wear it above the nose and wear it correctly. So masks work. There's no controversy about that.
All right, Dr. Chundi, thank you so much for joining us with your expertise here on First at 4.
Appreciate it.